you. Thank you so much. Hi, everyone. It's nice to be here, even though I'm not really there, but it's lovely I got to see some of the audience just before, and it's nice to see some familiar faces. And hi, everyone. Shall I share my screen? Yes. Oh, sorry, just give me 1 second. Okay, I'm hoping that you can all see my slides now, yes? Yes, could someone tell me if that is okay? You can see my first slide there.
Yes,
Okay.
Dr. Noonan, we can see your slides.
Thank you so much. That's great. Thank you. Thanks, everyone. Okay, so I'm talking today about compassionate communities and the care of older people. And so this really is an important topic following the conversation we've just had about palliative care as well. So I'm not going to be focusing on palliative care and as such, as in the delivery of healthcare services, but focusing on how public health palliative care has a role to play, in particular compassionate communities, and talk a little bit about that today. Do you want me to leave time for translation after every slide?
Dr. Noonan, you can go ahead with the English presentation. We'll have a brief recap in Thai, about 10-minute recap by Dr. Khon at the end of the session.
At the end, not now.
Not now, not now. Okay.
Okay,
Thank you.
Great. Okay, thank you. Okay. So I do want to acknowledge the traditional owners of the lands that I'm on here today. And I live and work in Dubbo. And Dubbo is the traditional custodians of the lands here in Dubbo are the Wiradjuri people. And I'd like to pay my respect to elders past, present and emerging, and extend that respect to other Aboriginal and First Nations people who may be present today at the presentation or be following along another time in watching online. So 2 things today. We're going to talk a little bit about what is compassionate communities and the role of compassionate communities in the care of older people. And I'd like to acknowledge the work of, and encourage you to go and look up some of this work as well. But I'm here following really as part of a team of researchers who have been doing this work here in Australia for a while. And in particular, at the moment, the Public Health Palliative Care Unit at La Trobe University, and the team led by Andrea Grindrod, who is also have an important initiative called the Healthy End of Life Planning app, or the HELP app, that is supporting people to develop their social and care networks when someone is dying or needs care. I'd also like to acknowledge our grants, the Australian Research Council and the Wicking Trust, who have supported a lot of this work in Australia over the years. So there are a number of texts really looking at compassionate communities, and I thought rather than kind of give you a whole list of references, you can take a snapshot of this slide, and I would encourage you to go to the Public Health Palliative Care International website, and on that website you'll find some resources as well, including a link to Compassionate Communities, but also a link to the Health Promoting Palliative Care textbook, which is now available for download from the Public Health Palliative Care International organisation. And that Health Promoting Palliative Care book was now written in 1999. So this work has developed since compassionate communities, and the ideas around compassionate communities has certainly developed a lot since that book was written in 1999. However, if you are interested in this work more, it's a really great book, a really great place to start. So let's start by defining compassionate communities and what we mean by this term, compassionate communities, because we talk a lot about compassion in palliative care, and that's really important. And compassionate care is absolutely the kind of centerpiece of palliative care and the kind of care that we provide in end of life and in aged care as well, when we're supporting our older people in our communities. The idea of compassionate communities, though, is it's kind of broaden our thinking beyond health service delivery. And so you can see in this definition, the definition is that communities that develop social networks, social spaces, and social policies, and support people through the many hours, days, weeks, months, and sometimes years of living with a life-threatening or a life-limiting illness through aging, grief and bereavement, and long-term caregiving. So this is quite a broad definition, but what it does is acknowledge the many elements of compassionate communities and the different aspects of what communities do when someone is older, and what we want to do and what kinds of things we need to do often when someone is older or when someone needs palliative care. So I'm going to talk about some key concepts today, just as a way to bring in thinking about how do we support older people that we might be caring for, and what does it kind of look like. I'm going to talk about public health approaches, and particularly approaches that address loneliness and the social determinants of health. Also, community-led support, so thinking about formal and informal supports, and I'll define that when we get to it, and talking about education and awareness, and how all of these things, these 3 or indeed 4 kind of key concepts, which are very, very big, and we could do pretty much an hour on each of these things, to really kind of think about these and how we provide care, in how we provide palliative care and deliver services to people, but also start to think more broadly about the contexts and the places that people are living in, that mean that we might need to think more broadly about the kind of care and support that we want to provide for people, and hence provide or hence start to think about how are we a compassionate community? How do we create those networks and supports around people? So I'm going to start by talking about the idea of using kind of the key public health concepts in an end of life and care of the older person, with a care of the older person focus. So the first is kind of thinking about health promotion. So activities, this is where we think as a service about the activities and policies that promote health and well-being. So often when we think about dying and we think about maybe someone who's aging or in the last few years of life, sometimes we're thinking mostly about what kind of medications they might need or how do we prevent falls, and they're an important part of public health as well. But we're also thinking about policies and activities that help support and prevent problems. So exercise programs, nutrition programs, for example, cognitive and dementia initiatives. So for some people that might be early intervention type supports, or it might be support for carers around dementia initiatives, but also early intervention programs such as fall prevention programs. So do we, even though we provide medical service for palliative care or a medical service for people who are aging, are we also thinking about the whole of the person? Are we thinking about the other programs and things that might actually support the physical and emotional well-being of people who are aging? And for many of us, and I think Thailand too, has a national healthy aging policy. And so how are we implementing that policy as part of the work we do in palliative care so that we are really getting upstream of people who are dying? So we're providing supportive environments, supportive care in those years before it gets to the stage where we start to need to think about the end of life and dying specifically. The other important part of compassionate communities that we talk a lot about in compassionate communities is tackling loneliness. So we know that loneliness is a really important part of human well-being. Tackling loneliness is an important part of our well-being programs, and for all people of all ages, but particularly for our elderly. So the kinds of programs that you might see in a compassionate communities focus on aging would be intergenerational activities and programs. So, for example, in Australia, we have aged care facilities that are sometimes built next to childcare facilities so that aged care and childcare people can interact and staff can interact, programs can interact. For example, there are programs now in schools that enable young people to connect with their elders. And I guess in a Western country, like in a country like Australia, where aged care is actually, there's a lot of aged care and we've got a lot of aged care facilities, then having programs that are built into aged care that enable people to reach both inwards to an aged care facility as well as outwards is really important in terms of intergenerational support and activities. And any social programs that reduce isolation. So how are we tackling isolation? So when we're seeing people who are aging and they're living alone, are we asking, as part of our clinical practice, are we also asking about who visits, how that person might get around to see friends, what's their connection to family like, are they using technology to connect with people? So any kind of program that reduces isolation. So you can see how health promotion activities, exercise programs, nutrition, early intervention and exercise programs and healthy aging policies are actually really interrelated to any kind of program that we might do that tackles loneliness, because in order to tackle loneliness, we're often encouraging people to kind of reach out to social programs or exercise programs or other programs in their communities that promote well-being. Okay, so community-led support. So again, this is where we think about in a compassionate community kind of framework, what we're thinking about is what can we do not only to provide services in our community, but what can we do to kind of understand more about the services that already exist in the community that we can tap into and encourage families and older people to tap into as well. So we know there's some evidence, good evidence to show that coordinated care is very important. Care that's kind of not coordinated, a bit that doesn't kind of flow well, or people can't find their services, in those cases, it tends to make loneliness even worse for people. So people perceive that they're more alone if care's not coordinated well. So that suggests that it can be helpful to have roles in your service that may look at the way that people can access services. In some countries, and in Australia, sometimes that role is called a navigation role, which is the next point. And we also have signposting roles in compassionate communities. So in compassionate communities, one of the key concepts is really being able to get a social safety net developed in our communities to ensure that when people are dying, the supports are already in place. So we're not trying to intervene at the end. We're creating an environment that enables those supports to get enacted when someone needs them at the end. So any opportunities that enable people to learn about the services, whether it be a walking group or a social group or an advanced care planning program or whatever it might be, that those opportunities are signposted to other community members, even community members who don't necessarily need them right now. So in some countries, we've found that in some research that has been done, having all community members have some level of knowledge about care of elders, aged care, palliative care, that actually can increase social cohesion, reduce isolation, and in the end, it enables people to access those services more quickly than they would have in the past. So when I talk about the navigation of services and supports, there are two things I kind of do want to define here because I think they're important. There are formal and informal services. So when we talk about formal services, we're obviously talking about healthcare services, nurses, health professionals, allied health professionals. We're also talking about volunteers, anyone who's connected to service delivery, who might have a job to do and go and do that in the community. And then there are informal services or informal supports. And they're our friends, our family, our neighbours, and our community, our school, our church, our temple, our spiritual groups. They're the places where informal support happens. And it's important, I think, in compassionate communities to think about these two things as they work together, but also understand them as slightly to give them kind of be clear about the definition so that we can bring them together. I think that's the best way to put it, because our formal services, and I'll show you some data and some research in a minute, our formal services don't often know or get insights into our informal services, informal support, sorry. Let me say that again. Formal services, nurses, doctors, healthcare services and healthcare providers don't often know about all of the informal supports that are happening around an older person or someone who is dying. And So that's why it's important to kind of think about these two kinds of support that are happening around people. So the other thing about community-led support, of course, is we know that planning ahead reduces stress on caregivers, and community conversations are really a very important part of community-led support, and what we might see in a compassionate community where everyone can contribute to the conversations that need to be had about aged care or palliative care. There's a question here. I might come back to the questions as we kind of move along. The next important concept is talking about the social determinants of health. So that is where we start to kind of understand really the importance of our social networks and social supports, but also that when we look at equity of access and we look at who's coming to our services, are we only reaching a certain number of people, a certain type of person in our services? Are there barriers for people to access the kinds of care and support that we offer? Is there a financial issue? Is there a transport issue because of rural and metro? In Australia, that is certainly the case. What about the physical environment? Is it possible for people with disabilities to access the services you provide? And what might you do then to address these equity of access issues for your service and for older people? So again, when we think about this from a compassionate communities lens, it kind of causes us to think beyond the service that we deliver and into the social aspects of the care that we provide. And finally, community engagement. So again, community engagement means lots of different things, and depending on your service and depending on what's important to you, but a kind of basic way of thinking about community engagement, because this is a key concept in compassionate communities. How are older people, if we're focused on care of the older person, and in particular like palliative care and end-of-life care, how are we involving older people in the design of the services that you provide? Are older people looking at the information you send out into the community or that healthcare professionals take with them on home visits? What about flyers? What about planning ahead? Have you ever asked older people about your advanced care planning tools and what they're like to do? What about place of service? Have you had conversations with your older people and the older people in your community that you might want to reach about the design of your services and where you offer them and the place of those services? The other thing that I do want to challenge is this idea that death is a taboo, and encourage you to think about the social context of the conversation around death and dying. And I guess in Australia, for example, we often talk about death being a taboo. However, this took me like a couple of minutes for a presentation I did a couple of weeks ago. I had a quick look around for all of the things that are happening in Australia that suggest that death is not a taboo. And this, I found many things straight away. Oh, sorry, I'm just going to... Oh, my apologies. Okay, so, and I found lots of things straight away that that showed that, in fact, there are lots of conversations, lots of information, lots of things happening from death cafes, like over 800 death cafes have happened in Australia, for example, there's World Compassionate Communities Day that happens every year, and Australians get involved in that. We have a Good Death Impact Network where there are many people involved from across Australia. There's Death Over Dinner, there's Dying to Know Day, there's National Palliative Care Week, there's National Organ and Tissue Donation week and month, and there are a few different kinds of conversations that happen around organ and tissue donation, as well as Advanced Care Planning Week, and also Grief Awareness Month as well. So there are a lot of initiatives and a lot of things going on. All of these things, even though they may not be run by clinicians or part of the clinical work that we do, they are still part of the social experience for people in our communities, and they provide opportunities for people to have conversations that they might not ordinarily have in communities. So again, remember, in a compassionate community, what we're thinking about is how do we give people some experience of these issues before they need our services, so that when they come to us, they're better enabled, better supported, better connected. Okay, so the final, and so this adds to this idea of education and awareness. What do older people in your community know about their care options? What about the support services? What about for you and your service? What do you know about the other services that might be around in your community that will also provide support and different supports around well-being in your communities as well? I think this is something possibly that we underestimate in palliative care services. So in Australia, we've done a lot of work to look at reminding community members that they have a lot of expertise in caring for people who are dying, as well as doing palliative care, family palliative care. So yes, we need services to deliver care, medical care and health care. However, 95% of the care that happens at end of life is, or 95% of the experience of dying and older people right at the end of the life is actually happening in communities with family members, friends and neighbours. So 95% is our kind of target population in compassionate communities. So the final thing, and I'm coming to the end of my talk today, final thing I want to talk about is all of this work that we do around compassionate communities, and some of the things that I've talked about today is really about building social connections and networks. But whenever we do this, we're also building death literacy. And this is some research that we did about a decade ago now here in Australia. And what you're looking at there is a care network. So you can see, hopefully in the middle there's a carer, and there's a couple of daughters, and then there are friends and family members, and then the community nurse, doctors and other palliative care staff. So you can see, if you look at that, and if I was there with you, I would love to hear your reflections about this diagram. But what we found over time is that these connections in many cases grew, people became more connected, and people became more supportive of each other over time. And they certainly supported each other after bereavement. And in fact, this network was an important comfort to people in the long run in their bereavement. So what we now know from the last decade of research is that these networks and some of the social networks that we've talked about today also grow death literacy. And why is that important? Because death literacy is the knowledge and skills that make it possible for us to access and act upon both our end of life as well as our death care options. So that is, we know what to do when someone is dying. We know how to access services. We know how to access the care that we need. And so this concept of death literacy grows. Death literacy grows because of networks, because people talk to each other, because people have conversations and connect to each other. And that seems to be the essence of a compassionate community and what gets shared. So I just want to sum up our role really in palliative care, and it's important in elder care and palliative care that we use a compassionate communities approach that sits alongside the healthcare and medical care that we provide, that we really integrate these two and have a way of kind of working with our communities. So how do we think beyond the walls of our hospitals to collaborate with partner and social services, our schools, our cultural groups, our spiritual groups, exercise programs? Who else? Everyone. How can we start to engage beyond the walls of the work that we do? Thank you.